Do you know that there are other ejaculation problems aside premature ejaculation? So yes, in today's video, I'm going to be discussing about 3 types of ejaculation that you should know. The first one that I'm going to start with is delayed ejaculation. It means that this person is finding it difficult to ejaculate, or the person does not even ejaculate at all. What is the cause of this delayed ejaculation? There are physical and psychological factors that might be causing this person to have delayed ejaculation. Psychological could be stress, could be depression, could be relationship issues, while physical has to do with the health, probably diabetes mellitus, multiple sclerosis, aging, injury to the bladder, surgery to the bladder or prostate gland, or even spinal cord injury. Also, there are some medications that their side effects could cause a man to have delayed ejaculation. Medications like antidepressants, some antihypertensive, some antipsychotic. So that is why if you are on any of these medication and you're experiencing delayed ejaculation, or you experience delayed ejaculation, please speak to your health provider, because they'll be able to help you on which medication to go for, and any adjustment that needs to be done, they will do it. In as much as I'm saying that some people have delayed ejaculation, there are some people that have too quick ejaculation. There is premature ejaculation. This one in particular, I love to describe it as when a man ejaculates when he or the partner, they are not ready for him to ejaculate. A lot of people out there today will call it, oh, he's a 1-minute man, because what you describe as premature ejaculation might be different from what another person would describe as that. Because if a man is lasting 1 hour and he notices that, oh, I'm now coming in 30 minutes, it is premature ejaculation to him, because he is not lasting for that 1 hour. Why some people is the usual 1 minute, which is after a few thrusts, the person will just come. That is why the definition varies. Occasionally, premature ejaculation happens to a lot of men, which they don't even talk about, but it becomes a problem when it's affecting you and your partner. That is when premature ejaculation becomes a problem. Just like delayed ejaculation, the cause of premature ejaculation can also be physical or psychological. Physical in the sense that it could be the prostate that has a problem, which it could be prostatitis, prostate cancer, it could be prostate enlargement. It can even also be as a result of the use of recreational drugs. That is why you need to stay away from alcohol and all this medication. It is not advisable for you to consume them. So just like delayed ejaculation, the psychological cause of premature ejaculation can also be, relationships. It can be due to stress, depression, due to anxiety. A lot of men nowadays, they are very, very anxious when they want to, have an intimate time with their partner, especially when it is a new partner. They get so anxious about their performance, if they will do it better, or if the person will enjoy it or not, and then because of that, it gets into their head. It is also possible that some people can develop premature ejaculation since they started having intercourse. There are some conditions that can make someone to be having premature ejaculation. One of it is called conditioning. This conditioning is basically when a young adult is masturbating secretly, and then he's used to doing it secretly and wanting to finish it on time so that he will not get caught. Because of that, he might develop premature ejaculation. Of course, it is not acceptable in our society these days that young adults or even anyone should do masturbation. Street upbringing and beliefs about can also make someone to develop premature ejaculation. Also, some people, due to traumatic experience that they've had in the past, this can make them to develop premature ejaculation. So these are the conditions that can actually make one to come up with premature ejaculation. So what can you do about premature ejaculation? Basically, I will still refer you to your health provider, because with this, you will be assessed on what you need. Either is the medication or, psychological counseling or something that could help you. So all of this, you need to speak to your health provider. However, my next video is going to be about the treatment available for premature ejaculation, for weak erection. That is what I'm going to be discussing in my next video. So if you have not subscribed, please subscribe so you don't miss that video. The third type of ejaculation you need to be aware about is retrograde ejaculation. Now, this is quite rare. It is not common, and this is basically when it is time for a man to ejaculate. The semen that is supposed to come out through the urethra that the man is supposed to ejaculate is not coming out. Rather, it's going up into the bladder through the same urethra that the urine is supposed to pass through. This semen is going into the bladder to mix with urine. How will you know that someone has retrograde ejaculation? If the person after intercourse there is no ejaculation of semen, there is nothing, or it is scanty, then it is probably retrograde ejaculation. Or after ejaculation and the person went to pee, let's say the man went to pee and then the pee is cloudy, the urine is cloudy in color, it is possible that the cloudiness is due to the mixture of the semen to the urine in the bladder. Although retrograde ejaculation might not really affect your health, however, if you are finding it difficult to impregnate your wife, or you are fighting infertility and you've noticed all these signs that I have listed, please speak to your gynecologist or speak to your doctor, because this could be the cause of your infertility. Imagine the semen that you're supposed to, ejaculate into your woman to get pregnant is going back into your bladder, and then you pass the urine which contains the semen that you could have used to impregnate your wife. So please speak with your doctor, because this might be the reason why that you are infertile. It is not a definite diagnosis, so please, that is why you need to get checked to be sure. What is the cause of this retrograde ejaculation? Retrograde ejaculation usually happens when the neck of the bladder refuses to close during orgasm. So there are muscles in the bladder and also in the neck of the bladder that makes it to close up tightly when you are ejaculating as a man. But in retrograde ejaculation, this muscle is not, functioning well, and because of that, during ejaculation, it will remain open rather than, being closed properly as it's supposed to. Like I said, it might be due to, the muscle of the neck of the bladder not working well. It could be as a result of surgery of the prostate gland. It could be as a result of diabetes mellitus and so many other things. Most times, retrograde ejaculation does not require treatment. And this is because even with that, you can still enjoy healthy life. However, if you're finding it difficult to impregnate your wife, like I said, or you're fighting infertility, this is a warning sign that you need to speak to your GP or your doctor, because like I said, this could be the cause of your infertility. So speak to your GP to be sure that this is not the cause of your infertility if you want to father a child. So with all of this that I have explained, it is always important, in fact I always advise that in whatever ejaculation problem you have, it is important that you have a discussion with your partner. Yes, communication is highly important. And this is because when you communicate with your partner, of course they know what to expect and they'll be able to support you. And it's not like you're putting them in the dark and when something happens you leave them guessing, oh, what is going on with him. No, communicate with your partner so you guys can go through stuff together. Yeah, it is important to communicate with your partner. Aside even talking about premature ejaculation, if you want to have a good life, it is important that you have a one-to-one chat with your lady or with your man. And this is because when you know what you experience or what you feel good at or what makes you feel good, you're able to discuss with your man, and next time he's able to do it well for you, and it's not like you guys are just doing guessing game. Of course not. So please communicate with each other. There shouldn't be anything that you should be ashamed of, especially when it is your lady or it is your man. You shouldn't be ashamed of anything. So yeah, thank you for watching up until this moment. I've come to the end of today's video. If you have not subscribed, kindly subscribe to this channel so you don't miss out on any of my videos, because you will definitely enjoy this channel. And please share this video with as many people as you can. That is the best way you can support me. And if you have any question or any video at all that you want me to make, please leave it in the comment section. I'll be very more than happy to provide the information that you need. And I will see you in my next video. Bye.